Good morning, folks. Ron Ray here with Turning 65 Solutions. Today's October 31st, 2023. We are dead in the middle of the Medicare annual enrollment period. That's that time from December 7th to October 15th. October 15th to December 7th, when you can make changes to your Medicare plans, Medicare Advantage plans, Medicare prescription drug plans. It's also the time of year when Medicare updates their co-pays and co-insurance. That's the amount of money that you have to pay out of pocket on original Medicare A and B. And that affects some Medicare supplements. Now, Medicare supplements don't fall under the annual enrollment period, October 15th to December 7th. You can make changes to those any time of year, but this is when we give you those new numbers. So we've already covered the Plan G and the Plan F in previous videos. Go look those up on our YouTube channel, just right down there below. Today, we're going to talk about the Plan N. This is another very popular plan. It's gaining in popularity since the Plan F has been kind of phased out. If you were going into a Medicare after January 1st of 2020, you cannot get a Plan F or a Plan C. Those are only for people who went into Medicare before January of 2020. Everybody else is going to be going with either probably a Plan N or a Plan G, or maybe even a high deductible Plan G. Those are be the three most popular plans. We've covered the other ones. Today we're going to cover the Plan N. So we're going to get our information straight from the horse's mouth right here, Medicare.gov. The choosing a Medigap policy. I realize that this says 2023. This is a government publication. They'll have the new version, the 2024 version, out to us in about June of 2024. But for now, we're working out of the 2023 version. I'm going to give you the 2024 numbers. All right. So this is a chart. This is on page 11 that compares all of the plans A through N. Today, we're talking about the N. Now, the Plan N, what it does is it simply just pays your share of the Medicare bill. So Medicare A and B, they pay their share, roughly about 80%, depending if you're in the hospital or if outside the hospital. It's could be more or less, but it's roughly about 80%. Part A has some deductibles and co-insurance. Part B has a deductible and 20% co-insurance, but just say it's 80%. Right? Plan N pays your share of all of the Medicare Part A costs. All right? All of your hospitalization, first 3 pints of blood, pays 100% of hospice, 100% of skilled nursing facility care, and 100% of the Part A hospitalization deductible. You can see these are all 100s right here. 100, 100, 100, 100%. Plan N pays 100% of your share of Part A expenses for hospitalization. Okay. Part B, under Part B, there is currently, it's 20%. So Plan N pays 100% of the Part B co-insurance, that 20%. Now, these little stars right here, you don't see this on any other plan. Those stars tell us that under Medicare Part B with a Plan N will pay 100% or all of your Part B co-insurance, 20%, except that at the doctor's office for an office visit, you might be required to pay up to a $20 copay, up to a $20 copay. Now, the doctor has the ability to bill you that. They don't have to. They can, but they don't have to. Up to $20 and $50 at the emergency room, which is still not bad. That's less than most Medicare Advantage plans. Most Medicare Advantage plans are going to be $90 or more for an emergency room visit. And if we're talking about a family doctor, they're going to be $20 or less for a Medicare Advantage plan. But for a specialist, they're going to be $30 or more. And those are rough numbers. They may be different in your area for Medicare Advantage plans. But for Plan N, this is the same no matter what area of the country you're in or what company you have for your Plan N. The benefits are all exactly the same. That's one of the good things about Medicare supplements is they are standardized from company to company, location to location. A Plan N is a Plan N is a Plan N. It doesn't matter. It's apples to apples. So that's the one thing I want you to watch out for. You can pay up to a $20 copay at the doctor's office, $50 at the emergency room. Okay, it pays all of the other Part B expenses The 20% after that, the other thing that does not pay that has changed that we need to talk about is the Part B deductible. Like the Plan G right here, the Plan N also does not pay the Medicare Part B deductible. So that's an annual deductible. This year in 2023, it's $226. So one time a year, $226. Next year in 2024, it's going up a little bit. It's going to $240. So there's your update. The Part B deductible and your deductible under a Plan N is going from $226 to $240. That's once a year. Usually your first office visit, especially if they're doing blood work, your annual visit is going to cover that. And then for the rest of the year, unless you end up paying a copay at a doctor's office, that $20 copay, you're going to have zero out of pocket. Now, one other thing that you need to be aware of, if you're not already familiar with it, with a Plan N, that's different from a Plan G. This is the big one, and this is what scares some people. But I don't think it's really something to be too scared about. It's just you need to be aware of it. Is something called the Part B excess charge. That is an additional 15% that some doctors are allowed to bill you. The Plan N does not cover that. The Plan G does. The Plan N does not. So if you end up being seen or served by a doctor who is a non-participating Medicare provider, or in other words, they do not accept Medicare assignment, they are allowed, though not required, to bill you up to an additional 15% above the Medicare approved amount. So they already bill 20%. That the plan N covers that after the deductible, but the Plan N does not cover the 15%. That's an extra 15%. Now, I'll tell you one thing about that. I used to think that was a pretty big risk, but some recent statistics tell us that there's roughly about 50% of doctors who are in that category. And historically over the years, statistically, what they tell us is that only about 5% of doctors actually bill that excess charge. So it is a risk. It can be a large number risk, but I think the likelihood of it happening is pretty low, and it can be avoided in most cases by just asking the doctor ahead of time, do you accept Medicare assignment or not? Or another way to ask it is, do you bill the excess charge, or are you our participating provider or not? If they're a participating provider, they are not allowed to bill anything over the 20%. If they are a non-participating provider, they do not accept Medicare assignment, then they are allowed to, though not required to bill the 15%. And only about 5% of the doctors who are allowed to do that actually do. So it's a pretty low risk. The difference in price in premium that you pay monthly for a Plan G versus a Plan N can be pretty significant. It can be $30 or $40 a month, or maybe even more in some locations. That really adds up. And for a lot of people, we're finding that it is worth that risk, especially if in, I would say, most cases, you can ask, and if the doctor says, yes, I'm going to bill you the 15%, well, you can just not use that doctor and go find one that doesn't. There would be some circumstances where maybe you don't have a choice. Like sometimes we find you may go to have an outpatient surgery, or maybe an outpatient surgery, and the anesthesiologist, you can't, in most states, unfortunately, still legislation doesn't allow you to pick your anesthesiologist, right? We're working on that in Texas and trying to get this choice of doctors mandated, or else they can't bill you anything above what your out-of-pocket is. But regardless, that would be one example of where you might be stuck paying that. But again, you can ask ahead of time, and if that outpatient surgery hospital doesn't allow you to bring your own anesthesiologist, and the one that they provide charges the 15%, well, maybe you can go find another clinic to get that surgery at. So there's always a choice, and but there's always a little bit of a risk. So that's what I want you to be aware of. So those are the major changes. I'm going to not carry this video out too long. It's just a quick update. The Part B deductible, which means your deductible on a Plan N, is going from $226 this year to $240 in 2024. That's really the only change. Nothing else about the Plan N has changed. That's it. That means that Plan N is a very, very good choice. We like it a lot, as long as you understand the risk involved with that Part B excess charge, and that risk is worth the savings versus a Plan G. So if you have any questions about this, or if you have a plan and you're not sure you understand it, or if I've said something that confuses you, I certainly do that once in a while, give us a call. The number is 830-217-6711. Also, look us up on the web at www.t65s.com. We've got an article about the Plan N, the Plan G, Medicare Advantage, Medicare Supplements, everything right there. It's all free. And in most cases, to get that information from our website, you do not even need to put in your email address. We don't care. We just want to get the information out there. But if you have any questions, give us a call, 830-217-6711. And we're happy to help. Folks, if you enjoyed this video today, if you found this information helpful, please give us a thumbs up down below. That helps YouTube get this video out to other people who are seeking the same information that you were today. Also, don't forget to subscribe to the channel and click the little bell so that you can be notified when we upload a new helpful video. I've got lots of updates coming out in the next few days and weeks as we move into the new year. Things with Medicare change, so we're going to be updating a lot of our older videos, and we'd like for you to be the first on the list to get those notifications. So we hope you enjoyed it, and we hope you have a great fall. It's Halloween tonight, so we're going to go out and we're going to the senior center, and we're doing a trunk or treating event at the senior center here in town, and we hope you have a great time. Hope you enjoyed it, and until next time, bye folks.